Hi, my name is KALATHEVI with the matrix number of 146941. Hope you enjoy this video. They call it development, they call it modernization, but I say it's a change with time. Ever since time has begun for us humans, there's always this one problem which has been a threat to our existence, and we call this problem the disease. Cancer is the disease of our time. One of the most common cancer is the colorectal cancer. 1 in 23 men and 1 in 25 women are at risk of developing colorectal cancer. Scientists have carried many experiments and researches, but we have no definite cure for this disease. However, there are developments in strategies for treating cancers with promising results. The cancer was once called the disease of the rich. However, now researchers have found out that prolonged poverty is associated with the risk of developing specific cancers such as colorectal cancers. Cancer takes place when a DNA responsible for cell division is damaged. When the cell with this DNA is present, it divides uncontrollably. So the colorectal cancer is the cancer in your large intestine. So your large intestine is composed of 3 main components, which is colon, rectum, and anal canal. Colorectal cancers start with small cell clumps called the polyp, which is benign and not malignant, which will not spread to other parts of the body. This can be only found in the lining of the large intestine, which is just a thin tissue layer. However, if these abnormal cells turn into cancerous cells, the polyp may grow and can extend further into the large intestine wall. If they are not treated, they may enter into the bloodstream and spread into the nearby lymph nodes. So over time, it may spread to other parts of the body, which will only lead to more developed tumors. So what causes this colorectal cancer? You are more likely at risk of getting cancer, colorectal cancer, if you smoke cigarettes, if you are physically active, if you drink alcohol, or you simply just have a family history of having colorectal cancer. You are also in a vulnerable spot of having colorectal cancer if you are 50 age or older, or if you have inflammatory bowel disease such as ulcerative colitis or Crohn's disease. So what are the symptoms of colorectal cancer? The symptoms include alteration in your bowel habits, so such as constipation, diarrhea, or unusually narrow stool with dark or black blood, or even feeling weak or feeble, or unaccounted weight loss are one of the symptoms. So there are 3 major treatment options for colorectal cancer. The first one will be the surgical procedure. So during colonoscopy, a cancer potential polyp will be removed using a flexible tube. A cancerous spot might also be excised if discovered. You might also need a surgery to remove an afflicted portion of your large intestine if the cancerous region is more extensive. Second option of the treatment will be the chemotherapy. So the chemotherapy uses drug that focuses and destroys the cancer cells. And the third option will be the radiation therapy. Radiation therapy is often used together with the chemotherapy, and radiation therapy uses high energy which focuses on the cancer cells and just shrink them and kill them.
A considerable proportion of deaths are brought on by the prevalent malignancy known as colon cancer. When detected early enough, it is easily treatable with surgery alone and might be prevented by screening. Patients with more advanced stages of cancer continue to live longer thanks to advancement in modern treatment such as radiation therapy.